You know that feeling when you're just totally wiped out and someone casually tells you, oh, you probably just need to eat more spinach? We hear the word anemia all the time, and we almost instantly assume it just means you have low iron in your blood. But honestly, treating anemia with an iron pill without actually knowing what's causing it, that's kind of like slapping a piece of tape over your car's check engine light and hoping for the best. Today, we're going on a bit of a medical detective journey to uncover what's really happening inside your veins.
Okay, let's dive into this explainer. We're going to systematically break down what anemia truly is, push past the old myths, and look at the fascinating reality of our body's internal life support system.
Here's our roadmap for the breakdown. We'll start with what anemia actually is, check out the causes and classifications, spot the symptoms, and crack open the diagnostic toolkit. Then we'll wrap things up with targeted treatments and debunk some incredibly common myths.
Starting right off with Section 1, what is anemia? The oxygen delivery problem. To really get a grip on this, we've got to zoom way, way down to the microscopic level of your red blood cells. So, technically speaking, anemia is a condition where your hemoglobin concentration drops below a specific reference threshold. And hemoglobin is absolutely crucial. It's the protein inside your red blood cells that literally grabs onto oxygen in your lungs and hauls it to every single tissue in your body. But here's the most important thing I want you to take away today. Anemia is not a single disease. It's a clinical finding. It is a massive flashing red flag indicating that your body's oxygen transport system is compromised. To figure out how that system fails, we have to look at how it's built in the first place. This process is called erythropoiesis, which is basically the biological assembly line inside your bone marrow. Think of your bone marrow like a giant, super efficient factory building millions of microscopic delivery trucks every single second. It starts with hematopoietic stem cells, which develop into erythroblasts, then mature into these younger cells called reticulocytes, and finally become fully mature red blood cells ready to hit the road. But to keep this factory running, you need raw materials, right? You need iron, vitamin B12, folate, and a special hormone from your kidneys called erythropoietin. If any of those are missing, the whole factory just grinds to a halt.
Which brings us nicely to Section 2, causes and classifications, identifying the suspects. When that factory inevitably fails, how do doctors figure out what went wrong? Well, clinicians usually start sorting the evidence by looking at the actual physical size of the red blood cells. This is a measurement called mean corpuscular volume, or MCV, and it brilliantly illustrates what's going on. If the cells are microcytic, meaning they're unusually tiny, the prime suspect is almost always iron deficiency. If they are normocytic, so normal-sized, but there just aren't enough of them floating around, it points more toward a chronic disease. And if they are macrocytic, abnormally large, that's a huge clue pointing right at a vitamin B12 or folate deficiency. So the size of the cell tells you the story of how it was made. Beyond just looking at the size, the underlying mechanism usually falls into one of three major buckets. Number 1, blood loss. This could be obvious, like from a trauma, or completely hidden, like a bleeding ulcer. Number 2, reduced production. This means the bone marrow factory is either missing nutrients or the factory itself is damaged. And number 3, increased destruction. This is where the body is destroying its own blood cells way too early, a process called hemolysis, which we see in things like autoimmune conditions or genetic disorders like sickle cell disease. Moving right along to Section 3, spotting the symptoms, the patient's evidence. We know the cellular mechanics now, but what does the patient actually experience day to day? When your oxygen delivery trucks are pulled off the road, your body literally starts suffocating at the cellular level. The result is this rapid-fire list of symptoms. You get hit with extreme fatigue and weakness. Your skin turns pale because your body is desperately diverting blood to your most vital organs. You feel dizzy, you're short of breath, and your heart races with palpitations because it's just frantically pumping, trying to circulate whatever tiny bit of oxygen is left. All of a sudden, just walking up a single flight of stairs can feel like you're running a marathon. But here is where it gets really interesting. Certain highly specific symptoms can point straight to the culprit. For example, iron deficiency can cause this thing called pica, which is this bizarre, intense craving to eat non-food items like dirt or ice. It can also give you really brittle, spoon-shaped nails. On the flip side, vitamin B12 deficiency triggers these terrifying neurological symptoms. We're talking numbness, tingling, severe balance problems, and even cognitive changes. These aren't just weird quirks. This is your body sounding a very, very specific alarm. So how do we verify those alarms? Let's transition to Section 4, Diagnosis and Clinical Evaluation, the medical toolkit. This is how doctors take those clues and turn them into hard evidence. It usually starts with a complete blood count, or a CBC, to get that vital hemoglobin number and check the cell size. A peripheral blood smear lets them literally look at the shape of the cells under a microscope. They'll also run iron and vitamin tests to check the factory's raw material inventory. But honestly, my favorite test here is the reticulocyte count. Remember those young, immature blood cells we talked about earlier? By counting those, a doctor can see if your bone marrow is actively fighting back and trying to save you by pumping out new cells, or if the factory has just completely given up. Let's look at how this plays out in real life. Imagine an older adult comes into the clinic. They are profoundly fatigued and keep stumbling because their balance is off. Step 1, the doctor notes the neurological link. Step 2, the CBC lab results come back showing macrocytosis, those abnormally large red blood cells. Step 3, they order a specific vitamin test, which confirms a severe B12 deficiency. And Step 4, targeted B12 treatment begins. If we didn't have this exact logical flowchart, someone might have just handed this patient an iron pill, which, by the way, would have done absolutely nothing to stop their neurological decline. And that brings us perfectly to Section 5, Targeted Treatment and Management, Solving the Case. The whole point here is that medical intervention must specifically match the root cause. If it's a straight-up iron deficiency, sure, we use oral or IV iron, but we also absolutely have to figure out where the patient is bleeding from. If it's a B12 deficiency, we supplement B12. And if it's anemia of chronic disease, say triggered by kidney failure or an autoimmune disorder, giving iron might not help at all. You actually have to treat the underlying disease that's causing the inflammation in the first place. Now, in really severe, highly symptomatic cases, or instances of acute blood loss, blood transfusions are a crucial tool. But, and this is a big but, doctors don't just treat a number on a lab report. The decision to transfuse is super individualized. It's based on looking at the whole patient, their active symptoms, their heart health, and whether they are actively bleeding right at that moment. Of course, on a day-to-day level, nutrition plays a massive role in maintaining your factory's inventory. We get easily absorbed heme iron from things like meat, fish, and poultry. We get non-heme iron from plants like beans and spinach. But here's a wild fact for you. Vitamin C acts as an enhancer, totally boosting your absorption of that plant-based iron. But if you drink tea or coffee with your meals, it acts as an inhibitor. The compounds in just a normal cup of tea can actually block the iron in your meal from being absorbed into your body. Crazy, right? All right, let's head into our final section, Section 6, Debunking Myths and Prevention, the final verdict. We absolutely have to debunk this right out of the gate. The whole cartoon myth that eating spinach alone cures severe anemia, it's just false, and honestly, it's a bit dangerous. Spinach is super healthy for sure, but if your anemia is caused by a bleeding ulcer, an autoimmune disease, or a genetic condition, there isn't enough leafy greens in the world to cure you. The absolute medical fact is that treatment must focus on finding and treating the specific underlying biological cause. It's also really important to remember that certain populations carry unique risks. Women are disproportionately affected because of menstrual blood loss, and during pregnancy, a woman's demand for iron just absolutely skyrockets to support the fetus, which is why clinical screening is a must. Children are highly vulnerable too. They grow so fast that their nutritional demands are massive. Plus, in many parts of the world, parasitic infections cause severe hidden blood loss, making accurate diagnosis absolutely critical for kids. But look, the future of hematology is incredibly exciting. We are rapidly moving toward a world of instant point-of-care testing. We're already using artificial intelligence to analyze blood smears with just mind-blowing precision. And maybe most remarkably, we're seeing the dawn of actual gene editing therapies, real cures for inherited genetic disorders like sickle cell disease and thalassemia. We are literally getting to a point where we can rewrite the flawed blueprints inside the bone marrow factory. I want to leave you with this thought to wrap things up. Anemia is not simply a lack of blood or a lack of iron. It is a complex medical condition with dozens of different causes. Your body is incredibly smart, and a drop in hemoglobin is a very specific distress signal. By understanding the actual mechanics behind that signal, we can drop the myths and embrace real, targeted science. So the next time someone tells you they're anemic, ask yourself, what's the actual cause? And how might knowing that change the way you advocate for your own health? Thanks for hanging out with me for this explainer, and keep learning.